With the digital transformation of healthcare, there's been an incredible amount of data, lots of data that is now available, whether it's to the clinician, to the care team, or to the patient. I think as the tools continue to develop, they'll really be able to transform that data into knowledge that the individual users can use to make a decision. As information technology continues to become part of our lives, I think that the way that the information is filtered so that each person can make a decision, whether it's a physician making a decision about a treatment or a patient making an everyday decision about what to eat or when to exercise, or for that matter, whether or not to wear a coat today because it's cold outside. But things like that, that's all actually information technology driven so that we can make better decisions and live happier, healthier lives. I think one of the rising roles is the role of AI or artificial intelligence. Even 5 years from now, when we think about all the data that is currently available to us, as the user interface becomes more sophisticated, perhaps next year I'll be wearing Google Glasses or some sort of input device where I'm getting prompts throughout the day on what my energy level is and what I should be eating or where I might have some nutritional deficiencies based on the information that's being gathered from sensors, but as well the algorithms that come from an AI or a deep learning or a machine learning algorithm. But these aren't just one or two algorithms, it's hundreds of algorithms, it's thousands of algorithms, really being able to harness our collective experience, but then tailor it to an individual. So the power no longer is focused on or centered around the healthcare establishment, but even now, 10 years after Google, patients are coming further informed, more informed than they've ever been before. And that knowledge gap between what the patient knows and what the physician knows starts to narrow, it starts to close. Patients are coming in with better questions, more information at their fingertips regarding treatment options, and really being able to provide that to their doctor as part of a shared conversation and shared decision making. So I think that's one big trend. And then the two is where healthcare occurs. So the traditional model is that the healthcare occurs in the four walls of our healthcare institutions, whether it's the doctor's office or the hospital. As technology allows those interactions to happen anywhere, whether it's in the patient's home or while the patient's on vacation or wherever that patient or the person wants to be, or the doctor wants to be for that matter. I think that the idea that medicine is done in a hospital or in a facility is really going to shift as care really starts transitioning to home.